Welcome back to the channel today. On the channel today I've got Lee Button, who sat beside me right here. Lee's a facilitator who's been working with a national NHS programme called GPIP, which is the General Practice Improvement Programme. And I just wanted to introduce him today because there are some changes that are coming not only at the Triage surgery but nationally. And I thought Lee would be in a really good position today to talk to our patients about first what the GPIP programme is, and then hopefully on a later video we'll talk about what that means potentially for our patients day to day and with access to the surgery and how the surgery will be running. So Lee, thank you very much for coming onto the channel. So could you just explain that? So you've been working with us for a little bit of time now as well, just to explain your role and why it is we have had to work at this project.
Yeah, so this programme is designed, as you just said, it's general practice. It then says improvement programme. But what it's about looking at what has changed in kind of like general practice and the doctor's surgery particularly, and looking at that on its local context and what that looks like against national context and what it once was and what currently is going to be. So we know that population has changed. There's definitely a post-pandemic change to how things are. We know that complexity, we know that people live longer with health conditions, and we've got frailty and things that come in from much older brackets. And actually how we start off at the very beginning, our journey into it as well, into joining a doctor's surgery. So the programme is really designed for us to dig behind some of the data. Things looking at population numbers and health conditions, use of phone systems and the phone data and access related information.
Yeah, because that's been a big issue, hasn't it, about access to the GP.
And we get that balanced with what we hear in the news and what we hear from our neighbours and friends. And so actually we need to get to objective data as well as the subjective element of it. And new tools have come along. We've got apps, we've got electronic means of contacting the practice. There's a whole host of different staff in general practice now. When we talk about allied health professionals, some of what we used to access within the secondary care, the hospital environment, is now available to us at a primary level. This is great news for people that are trying to get the help and support that they need. But do they know where it is and why we're now saying that, well, it's not the doctor, it's this person. It's about the clarity around that. So it builds up this diagnostic picture, and then we look at what our demand is, how we shape capacity to meet that demand, and what other things we might need to do and how we can utilise them. And it's that patient-centred piece, right? We've got to make sure that a patient gets to the right place at the right time.
For sure.
And it's balancing those things when we've got a certain capacity against that demand. So that's the rough shape of the programme. Weeks of diagnostics and looking at learning how we utilise the data, new computer systems, those things have come in. Have we learned what they mean? Have we learned how to do the analysis? And then off the back of that, we pick projects about where we can make improvements, where we can streamline things, how we can do more within the staffing that we have, the systems that we've got, make tweaks and improve it.
Oh, great. So, I certainly sort of feel like from a clinical perspective as well, it's almost the change of doctor necessarily isn't always the right person anymore to solve your problem. And so we're part of a big wide team, and you're absolutely right, we've got a lot of healthcare professionals who work directly with us, and it seems to be more about improving the patient's journey to get this problem.
Absolutely.
There's a solution to that, and as you say, that may not always be the doctor as well and things like that. So for us here specifically at like the Triage surgery, what sort of things have we been directly looking at? Because I know what I hear from our patients and things like that as well, access is one of those things that they're always talking about, getting in contact with the surgery.
So one of the key things that came out that we wanted to look at was first off on two points of access, because we will always have footfall. There's always people that can walk into a practice. But we've got an online access, and then we've got telephony, and everybody's very familiar with contacting a practice through the phone system. That's the age-old one. Now there are improvements available in new phone systems. So one of the priorities that we looked at was upgrading the phone system to a new provider that allows us to have better features, to capture more data, to have messaging and signposting built into the system. So we're going to introduce things like callback functionality. So no more, there's always going to be wait times on the phone system, but to better utilise your time so that you're not hanging on for, just listening to some hold music. When the queue is above a certain point, you hit whichever number it is to kind of reserve your spot, and the system phones you back. This works so well, and it means then that when you've got the point where you enter the system, your place is reserved, and then when the phone call happens, you are just limited to the only time you're spending is the time that you're talking. This is much better. Like we've all got other things on. There's interruptions left, right, and centre. So it saves you having to carve out that time or worry. The other bit about it that we're kind of following on with is around what it looks like now. The words for it are signposting and triage. But don't have to worry about what those things are. What it means is the signposting is we have a trained staff at that first point of entry that are going to be navigating our care.
Exactly.
And they have the systems in front of them, they have clinical support alongside them to make sure that we are assessing appropriately, gathering right information, looking even at the patient record. So it's all available to say, if you go to the pharmacy now, and we'll have all heard of Pharmacy First as a kind of a rebadge of a program to work with our pharmacist colleagues to better get you straight to support where it's required that doesn't need a doctor.
The best person.
And they're funded for it. And sometimes that might be things that we shouldn't be seeing, but they're getting paid for it and there's a contract for it. So we need to make sure they're going to the right location. So signposting is just around some common conditions where you can get the best care first time. Then we've got this triage element, which is kind of more about the time frame, and this is clinically supported. So we've been looking at what it looks like to get the clinical support into that assessment, so that when we bring it up, we can capture information and we can say it needs an appointment today, or actually you can be seen in the next few days. Or just to make sure that we're not wasting anybody's time. Before you're seen, we need photos, we need a diagnostic test like a blood test, and it's to make sure that we've got things happening in the right order. These are little things that when they creep through on a day-to-day basis, or we're dealing with regular contact, that the inefficiencies there can really impact how we work with patients, impacts our own staff. So we've been looking at the phone system element, the website to support it, and then the training of staff to make sure that they are skilled and equipped, and that the clinical support is alongside them, that the signposting and the triage gets people to the right place quicker.
So I think Lee's gone through that all really well as that overview, as a lot of these changes are coming in to not necessarily change what we are doing here at the surgery or what we do for our patients, but it's more about efficiency with navigating the patients through the process of the surgery when they present to the door. So look, as in Lee's given a great overview there will be a subsequent video coming out where we just have a talk with Lee about more about what that will mean for you guys as patients, about what changes and why we may be encouraging you as a surgery to utilise certain tools like e-consultation we maybe haven't chatted about today, or why engaging with our staff at the point of access in regards to questioning will also help improve your journey. So that will be coming out possibly at the same time as this video is released as well. So if you want to hear that video and more content that's coming out from the Quarterjack Surgery about keeping you guys informed, clicking subscribe just means you get notified when videos get released. And I hope you found this useful today, so thank you.